I was supervised as a provisional psychologist, there have been some really good experiences and some not good experiences. And I think one of the things that motivate me to continue supervising is to ensure that those who are in the early careers are getting good experiences, because that really shapes how they, continue to be clinicians. And, having that initial confidence makes a big difference, I think. And I guess in my role, there is that safeguarding aspect. I think it's really important because we have such a big number of psychologists working in our field, really safeguarding the quality of the work and ensuring that people are doing best practice and safeguarding our profession as well. I think that's very important for me. What about you, Lorraine?
Yeah, likewise. When I think back to when I was going through my registration period, there weren't a great deal of psychologists working in this area at the time, and it was quite difficult to find people with that level of experience to provide supervision. And, the presentations that we get sometimes are quite different from the norm, so it's very important to have some standards there for how we supervise provisionals going forward, and that they feel supported in the work that they're doing. And as you said, we're safeguarding to make sure that the work we're doing is evidence-based and the provisionals are working within their competencies. I think when we're supervising provisional psychologists working within or working with people from those high-risk populations, it can be very different to doing that sort of stock standard work or even just work within more traditional frames. So it's really important that we're providing a lot of support to our supervisees and that we're making sure that we're walking very tightly alongside those competencies to make sure that we're not straying too far into other areas that are kind of outside of the work that a psychologist would be expected to do, but also trying to manage, I suppose, the pressure that comes from other workforces or from the workplace itself. With some of our provisional psychologists, it can be difficult to find professionals that will work with complex cases and so on. So we do need to make sure that there's a lot of support given and that we're really on top of what work they are doing.
Yeah, I agree. There's definitely a lot more intensity involved in kind of monitoring and safeguarding. And it also just depends on, I guess, the supervisor's experience. Because for me, I supervise provisional psychs doing their internship, registered psychs doing their registrar program, and it kind of obviously depends on what's expected for that level of training. But it's also, I think, balancing, being a little bit directive because there are clear protocols to follow in terms of risk assessment and management, but also creating that space to have discussions around those grey areas. Like you're not quite sure if it's breaching confidentiality, is it unethical to be disclosing information, or is this actually a risk? So having those conversations and allowing the supervisee to have that space to do that and express uncertainty is really helpful, just so you're kind of modeling what ethical decision making looks like.
Yeah, I think that's a good point.
Yeah, but there are, I guess, luckily, there's clear competency frameworks around risk assessments. So, we're not just basing it on what our supervisors we think is needed. Luckily there are things that we can actually refer to. So that's helpful too.
That's right. Yeah.
With anything, it starts off with a strong supervisory alliance, because if you don't feel safe in that supervisory space, you're not going to be bringing up things that you're not certain about, that make you look like you're incompetent or not doing the right thing. So, you want your supervisors to feel comfortable because you're overseeing their work. We have a duty of care to ensure the work that they do is not doing harm, but also ensuring safety for our clients. So I think that's a first step, really.
Yeah, I agree. I think we need to consider how we're assisting our supervisees to gain these skills. And so we do need to look at their observations that we can do, what sort of feedback do we want to give, and what sorts of assessment tasks can we set or that are already set within the frameworks that we can use to gather information and review the work with our supervisees as well.
Yeah, and when you have those clear benchmarks, then you can see where those gaps are and kind of include that in the supervisory plan. I mean, the literature says that unfortunately role plays are a very great way to learn, even though a lot of supervisors don't love it. It's actually really effective, particularly for supervisors, to demonstrate the skills needed and do simulations in a space that's safe to do so.
Yeah, for sure. And I think it's also a chance. We see a lot of supervisees with imposter syndrome, and they sort of really worry about that they're potentially stretching outside of their limits, even though they're not. They're just kind of out of their comfort zone, which is a great place to learn, sort of supporting them through a lot of those conversations, and feedback across role plays and things like that is a really good way to address and get some confidence up as well for them.
Yeah, and I think normalizing, when supervisees are presented with new presentations, it's going to be uncomfortable and it's going to be a bit nerve-wracking. And, if you got that added risk involved, of course, it's going to be more anxiety producing. And so I think normalizing that, but also, supervisors are in a great position to advocate for the supervisees if they feel that the clients that they're seeing are outside of their scope of competence, and they will have a better judgment around what level of training is expected for the supervisee and what skills they have acquired and have yet to acquire. There are some standards around competencies for supervisors, so I think it's important to do a reflective activity around, are these all the areas that you have competency in, or are there gaps that require more training and support? So, then you're also being clear about your area of expertise, and it may not be in all areas of risk, and that's okay, but it's communicating that clearly, ideally before you start that supervisory relationship.
Yeah, I agree. And I think once you've sort of honed in on those areas, it's also good to start thinking about any industry standards that are out there within the world that the supervisee is working within, because we can align those often with our practice standards and our competencies and make sure that we're covering off a lot of those areas with our supervisee.
Yeah,
and if needed, we can always look at setting up with another supervisor who is across some of those areas as well.
Yeah. And I think also being a good role model as a supervisor, a role model who's, able to model emotion regulation, because it is a stressful area to work in, and, be able to consider the gray areas and sit with those gray areas, because often those ethical situations aren't clear, so that we can then, discuss and make decisions based on an ethical decision-making model.